When we talk about autism, now autism, if specifically I speak about autism, in the era which has been post-COVID era, the number of cases have really been increasing a lot. And one of the major reasons why I see the patients, the children who were perfectly all right, that they are now having autism. One of the major reasons why I feel that the number of cases are more, a major reason why I feel that is happening is that the interaction. A child learns from the interaction from the world around him or her. And COVID was an era when the communication, interaction which a child could have done with the world around him really decreased out. Now, what resulted out of that was that the interaction between the conscious and the subconscious mind of the child, which generally increases as the age of the child increases, that could not increase. We could see many of the children who were confined to a particular place where there were not many other children with whom they could interact, they could play with, and at the same time there were cases where the parents, since it was a lockdown, parents were there at their own place and they had to work by themselves. The parents were compelled to provide mobiles and excessive television to the children, and they went in a virtual world. So all of a sudden we could see that the number of cases who have been autistic, all of a sudden they increase. And now when the parents, they come to us for treatments, for finding out the resolution of this phase called autism, I always guide the patients, I always guide the parents instead, that see, autism is a temporary phase in the life of a child, but then it needs to be treated in a proper way and timely. And when I talk about any kind of autism treatment for any child, what is the most important to understand over here is that merely purchasing supplements from the racks, from online stores, from anywhere is not going to take out your child from this phase. It requires a proper planned kind of a treatment through which the child can come out of this phase. How? When we talk about how it can be done, the most important over here to remember is that, see, in my research which I did, I researched that when herbs are combined with the psychotherapy techniques, it's then that the child will improve. I come across so many parents who are virtually giving good herbs to their child. Those herbs can be of any brand, but then they are without planning. There are herbs which can activate. There are herbs which can relax our nervous system. Both cannot be given together. We need to plan. What is the age of the child? What are the current signs? Is the child using more of conscious mind? Is the child using more of subconscious mind? And again, those herbs, the changes which are observed from those herbs need to be very nicely planned in a synergism with a trained psychotherapeutic guidance. For example, if we are giving a particular combination to the child and the parents are willing that the child should be able to speak in a better way, but at the same time, with the positive changes which those herbs are bringing in the child's life, the parents are too attached to the child, and despite our instructions, the parents do not wait for the child to speak, and instead merely when the child is with his or her actions able to convince a parent or a caretaker that, see, this is what I want, and the thing goes to the child, the negative behavior which we do not want to reinforce gets reinforced. And despite the best of herbs, if that thing is done, maybe after a few months the parents will say that the child is still not speaking, and that was what was expected. So it's very important to understand over here that wherever I might be traveling around the globe, I generally go live for all such patients of mine and those who are not taking treatment from me but from anywhere else in this globe. I generally go live so that I can guide, I can educate them all.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.